I've been fortunate, personally have been able to get the vaccine, and it was easier than actually getting the flu shot. And about maybe 20% after the second shot, people have some lingering effects. It could be a headache, it could be a little chill, a fever, but usually that dissipates within 24 hours. When we knew we were getting a vaccine and really being sent into our organization, we tried to figure out what were the best locations for us to start. And of course, the first one was our North Baton Rouge clinic. We have a very large complex. It's very open, very spacious, and so that was extremely important, especially most of those patients are underserved, and that was a critical element of our decision. The second site was down in Ascension Parish, down in Gonzales at our St. Elizabeth campus, and that also serves a great geographical group of individuals that met the criteria. And then lastly, because our healthcare workers predominantly are within Our Lady Lake proper, we decided to have another site inside of Our Lady the Lake itself. As we saw with COVID itself, people that have high-risk conditions really are suspect to having very poor outcomes with COVID. And we have a disproportionate amount of people that have high-risk comorbidities located in North Baton Rouge. And as we've seen a lot of patients being admitted from that area of town into Our Lady of the Lake over the last year, we felt it would be vital for us to make sure we have good location in North Baton Rouge for our vaccine deployment. It's very easy to get an appointment. You just have to go to our website. In Baton Rouge, it's Our Lady of the Lake. You can just Google Our Lady of the Lake, OLOLRMC.com. Or if you're outside of Baton Rouge, you can go to our health system website, which is fmolhs.org, and you'll be able to then pick a location across any of the markets that we serve. We reached out to Pennington. Dr. Kerwin and I had a couple conversations, recognizing that at some point in time, we will have more vaccine available for the community. And reading other places around the country, we call these maybe super sites or mega sites. And so we said, let's go ahead and plan one sooner than later, because as we ramp up our ability to really have more and more patients to be vaccinated, we needed a location. So Dr. Kerwin and I then worked with the Department of Health, and we set up our Pennington clinic location, and we anticipate that we'll be able to do about 7,000 a week once we have availability of vaccine.
I got my vaccine on the first day that it was available, primarily to show the staff that it's safe to to get vaccinated. To this day, we still only have about half of our staff willing to take the vaccine. So anything that we can do to encourage them to get the vaccination is very, very important. And so I got the vaccine the first time. It just hurt a little bit on my arm. By the time I got my second vaccine, I did have a full day where I felt like I had almost like the flu. I went to bed really early. I had a headache, not too bad, but I had a headache. Overall aches in my body, and I went to bed really early, slept for 12 hours, and the next day I was okay. We have two main locations, one at the Bluebonnet campus and the other one at the Mid-City campus. The procedure is you're either one of our patients, in which case we're going to be calling you, set up appointments and so forth, and also for the general public, there's a way through a website to be able to sign up and get in the line. So when we have availability, we then call you and set up the time, give you the vaccine and so forth. So far, we have been able to vaccinate roughly about 100 to 200 people a day. And it all depends on availability. And so that has been the success that we've had so far. We probably are in the several thousand that we've vaccinated since the beginning. And a lot of demand for it, and the process itself, the patients tell us, has been very, very smooth. The advice, first off, is just to know the data, know that the results of the study were very, very positive. Out of 20,000, 25,000 people who got the actual vaccine, only a few of them got COVID, versus in the other group that did not get the vaccine, they got the placebo. Roughly about 150 people got COVID. So we know that it's very, very effective. Even after the first dose, you already get a significant amount of protection. Once you get your second vaccine, once you get exposed to COVID, you don't have to quarantine, so it's all positive. The likelihood of you getting infected after getting exposed is very, very low, and the likelihood that you would transmit that to somebody else is also very, very, very low.
I first received the COVID vaccine December 16 and completed my second injection on January 6. I was one of the first at the hospital to receive the vaccine, and I certainly would do it again. One of the reasons that I was one of the first in the group was I thought that it would be a good example for others. There's no reason that I'm aware of that patients in our community should not be anxious to take this vaccine and acquire the immunity that will bring us the herd immunity to get through this COVID pandemic. Actually, I had no problems with either one. The first vaccine was a little soreness in the arm, much like the flu shot this year, and my second vaccine was less pain than I had had with the previous. So I had none of the potential side effects that we've seen with some other patients that have perhaps had mild reactions. They've had flu-like reactions, maybe aches, pains, low-grade fever, most lasting less than 24 to 36 hours. There were a couple of younger people who felt more affected by the vaccine, like a mild case of COVID, again, very short-lived, and we know that to be a tendency more in the younger population than the older because of their potential ability to have a heightened immune response to the vaccine. Let me first say that this vaccine is very safe. It has gone through all of the necessary steps to be a safe vaccine. The technology behind these vaccines is not totally new, although it is new to the vaccine process itself. The overall process from the lab is not. The messenger RNA component of the two most used Pfizer and Moderna vaccines now are simply a way of bringing the message from the virus to our body, into our cells, so that we can make that protein and have an immune response, produce antibodies that will later fight that infection if we're exposed. So the process is very safe. We're not injecting a live virus. We're not injecting foreign material that the government can track us. There is no effect on fertility. We know that the American College of Obstetrics and Gynecology strongly recommend that women who are pregnant or of childbearing age that are at risk should, in fact, receive the COVID vaccine. And so there are no indications that there are any molecular change or structure to our body or any ill effects other than potential side effects that any vaccine reaction might have. Achy, fever, chills, sluggish fatigue for a day or two. We're seeing the variants pop up internationally. They're commonly known as the UK strain, the Australian strain, the South African strain, and these strains, it's typical for viruses. Viruses mutate all of the time. There's tens of thousands of potential mutations that these viruses can undergo. The virus's main goal in life is to live in the human body and to be able to succeed at doing whatever it's meant to do, cause infection or just live harmoniously inside of our body. And so the viruses typically mutate. Only a few of those are clinically significant. And when those mutations change the structure such that the virus becomes more virulent or stronger in attacking our body, is there a concern? And we're starting to see those changes occur with these strains that are moving across and around the world. The United States is just starting to detect those strains predominantly because they haven't been testing for them. Other countries have been testing those genome sequences much faster than we have. We're starting to, because we're starting to identify those strains. We believe that somewhere between March and the summer that we will have a new virus strain that will be predominant to the current COVID strain that we have, more likely the UK strain, as it's predicted right now. We know that this virus is much more virulent. That means that it's much more contagious, it spreads much more rapidly and more easily, but not necessarily is it more severe. Doesn't necessarily make us sicker. And so it is concerning just for the large numbers. And as we've seen the resources utilized when more people are sick, maybe even sick enough to go to the hospital. The vaccine, interestingly, interacts for the most part, we believe, with these strains, either by decreasing the severity, again, of the illness or preventing hospitalizations. Thus far, we've seen no reason to think that we will not have at least some immunity to these strains. The good thing about these types of mRNA vaccines is that they can be changed on the fly. It is going to take 6 or 8 weeks to come up with a new structure, but as long as we know the DNA and the RNA sequence of that virus, in other words, its library, the book's in that library, and we can tell the vaccine to go, give it instructions to go make more of those books, then our body has an opportunity much more rapidly to develop those antibodies. So we should be able to ramp up a new series of vaccines should we have to. Right now, we're not sure how long the vaccines that we're currently given are going to last. Will it be 6 months? Will it be a year? Until we've had time to go through that phase, we really won't have an idea. Right now, we're hoping for at least 1 year, long enough to get everyone immunized and start to get that herd immunity. I'm optimistic because I believe that our communities, people, not only in the United States, Baton Rouge, Louisiana, but around the world, are starting to see the significance of this virus. We're all feeling it. And while we're all very tired of dealing with this pandemic and this virus, it's become obvious that we still must wear masks, we still must social distance, we still must wash our hands more than we ever have, and give the vaccine an opportunity to work so that we can continue to fight this virus until we have herd immunity.
We've created a critical resource for our community. The COVID vaccination super site is uniquely positioned to provide easy and quick access to thousands of our citizens. We have successfully created a clinic that has the capacity, I emphasize the capacity, to vaccinate more than 7,000 patients a week. Our capacity will only be limited by our supply.
One of the things that we've learned throughout this pandemic is that testing is important for everyone, and not just the folks who have symptoms at the time. There are a lot of asymptomatic carriers who can spread the disease. And if we're just testing people who have symptoms, then we're not picking it up across the board. That's really problematic in terms of spread and our ability to be able to manage and mitigate the disease. So we recommend testing for everybody. I think our black communities and our underserved communities are particularly vulnerable. What we have seen is that whilst blacks make up about 30% of the population of the state, they've experienced over 40% of the mortality or deaths associated with COVID. So we strongly recommend that for members of those communities. And we are trying to get that testing into those communities so we can help serve that and meet that need. We have set up a testing program that we are taking into the communities. We went out and obtained funding from the National Institutes of Health to be able to conduct a testing program in underserved communities. We partnered with the Mayor's Healthy Baton Rouge initiative to be able to implement that. We're using saliva testing, and so this is where somebody just spits into a tube as opposed to the swab up your nose. And we think that that's going to be a little easier for people to do. It is free, and we expect to be able to deliver that test to about 2,000 people in various zip codes and underserved communities here in Baton Rouge.
One of the most common questions I've heard from members or patients is that they're concerned that they may have to pay something out of pocket for the COVID-19 vaccine that has become available. The good news is that the federal government has actually allocated money and paid for the vaccine itself, or the medication that is in the vial. They have actually paid for that themselves and are distributing it across the United States. So the vaccine itself is being paid for by the government. The other piece of that cost that may be associated is from the physical act of administering the vaccine or giving the shot, putting the shot into your arm. That cost is actually covered at 100% from all insurers, the majority of all insurers, including Medicaid, Medicare, and commercial insurers. There's only a very, very tiny portion of some medical insurance plans that may have a small cost associated, but the vast majority are covering all of that cost at 100%. Also, if you don't have insurance, the federal government has also allocated money to cover those people to get the vaccine without any money out of pocket. People have also been asking, are there any side effects to the vaccine, or are there any side effects that they should be concerned about? The first thing that I typically tell people is that if you've not had a problem with a vaccine before, you probably aren't going to have a problem with this vaccine. There are some very particular allergies that some patients have that they may need to be concerned about with getting this vaccine. So if you've ever had a problem with the vaccine, or you're concerned about any possible allergic reactions to the vaccine, definitely talk to your regular provider, especially if you have a history of allergic reactions. The most common reactions to the COVID-19 vaccine are the same as for any other vaccine, including things like the flu vaccine. Because the vaccine stimulates our immune system to fight off disease, we may feel some of those effects of our immune system being activated. Things like fatigue and soreness or body aches, maybe even a light fever. But those things are very normal for all kinds of vaccines. But again, if you have any medical conditions or you're concerned about your history of allergies, definitely reach out and talk to your own healthcare provider about those concerns.
Well, we believe that 2 weeks after the vaccine series have been completed, either with Pfizer or Moderna, that you're 95% protected. It doesn't mean that you still cannot become infected, meaning the virus enter your nasal passages or live in your body and be able to pass it on to others. So we're still cautioning patients to be very protective, to not engage in very large parties, wear the mask, wash your hands, essentially stay the same. We can feel more comfortable because we have that added protection behind, but it doesn't quite give us the freedom to run around maskless just yet.
I would just say, read the data, read the studies for yourself. And if you're on the fence, particularly if you're in one of the groups that is currently being vaccinated, right now we're vaccinating 65 and above, it's a very, very positive experience for yourself to get the vaccine, and then the side effects are minimal, and your protection is very, very, very high, not only for yourself but also for other people that you might get in contact with. So I think overall, if you're on the fence, read the information, and then once you read it, I think you'll be convinced, like I was, that the best alternative is to actually get vaccinated. Because if you don't, the alternative is that you may be one of those 1% or so of people who actually get infected and actually have to end up at the hospital and potentially could die from the disease. So it's either, you got a 1% chance of potentially dying or not dying. And so to me, it's very clear, decision to make, given those two alternatives and given the percentages that we're talking about.
I've seen firsthand of the effects of what COVID does for patients, and it varies. There's no rhyme or reason why some people might be asymptomatic or some being so chronically ill they actually die because of COVID-19. And if you believe that you're going to be asymptomatic, you're kidding yourself, because you really don't know what genetic material is inside you that may affect you to be chronically sick or even die because of it. And if your chances of really reducing that hospitalization and maybe reduce you from dying, why wouldn't you take the vaccine? It's so important for you, for your own health and well-being.